I'm going to introduce our next speaker, who is Mr. Dal Babu. He's going to be talking to us about the impact and post-traumatic stress of COVID-19 pandemic lockdown on NHS Black key workers' emotional and mental well-being. Right, I'm going to talk a little bit about Mr. Badu. He served for over 30 years in the Metropolitan Police and is the former Borough Commander of Harrow. He was the first chair of the National Association of Muslim Police, which worked with Home Secretaries, Chief Constables, and community leaders. He has been a vocal and uncompromising advocate for equality matters and is a regular contributor to BBC, ITV, Channel 4, and radio news items, specifically on race, counterterrorism, gangs, and crime. In 2010, he was elected to the National Police Superintendent Association of England and Wales. He has extensive board-level experience in policing, community safety, child and adult safeguarding. In 2010, he was awarded an OBE for services to the police and communities. So let's welcome Mr. Badu.
Okay, so I'm going to talk a little bit about post-traumatic stress syndrome, and basically this PTSD. It's very, very important that we recognise the impact that post-traumatic stress disorder is having on many of us, if not all of us, particularly with COVID. And the press are talking about it much more openly, because in the past there was much more of a stigma to talk when you talk about your well-being, particularly your mental well-being. But the mainstream press in this country and across in America are now much more prepared to talk about it. So headlines from various publications show that the toll of COVID is having on the mental health of people around the world, specifically on nursing staff. The International Council of Nurses highlighted the increase in anxiety and stress for nursing staff during COVID crisis in countries around the world, not just here. And I think we really need to understand the huge sacrifice that nurses are making in terms of working within the NHS. And we have this highlighted in mainstream newspapers, some sort of newspapers very right of the political spectrum. So the Telegraph talked about health experts warn of a COVID-19 mental health crisis. The World Health Organization is talking about the need for substantial investment to avert mental health crisis. Coronavirus pandemic is pushing America into a mental health crisis. That's from Washington Post. And even in The Guardian, they're talking about it much more. And The Guardian have been very, very good, but they're talking about it much more. So it is a real issue. It is not something that we think maybe, it's really happening. And those of you that saw the news yesterday will see a big focus on people who had COVID, thought they had a very, very mild impact of COVID, but are now really, really struggling very, very hard to cope with COVID. And I think one thing that really struck me when I was researching this was how when people are embarrassed about post-traumatic stress disorder, we need to be very, very open. And it's interesting in Deuteronomy chapter 20 in the Bible, it talks about post-traumatic stress disorder, but doesn't necessarily call it that. It says, when thou goest to battle against thine enemies, and seest horses and chariots, and people more than thou, the officers shall say, what man is there that is fearful and faint-hearted? Let him go and return to his house, lest his brethren heart faints as well as his own. And for me, I think that was a real recognition in the Bible at an early stage of how post-traumatic stress helps, is helpful to recognize it and have an understanding of it. And in our modern world, it is and I'm talking about the sort of the Western world here, very much here. But if you look at the Industrial Revolution, it gave rise to civilian humans, made disasters such as railway accidents, and physicians were puzzled by psychological symptoms displayed by survivors with disputes. between those who believe in organic and emotional causes, the battles of World War One, where people were suffering from shell shock, as they called it there. So, and the brutal nature of war, where if you were suffering from post-traumatic stress disorder, although they didn't recognise it at the time, then you were taken out and shot for being a deserter. So brutal. And I think the Vietnam War is particularly interesting, given the number of people of colour that were conscripted and made to go out and fight in the war. And the average age of recruits who went out to Vietnam was 19. When I say recruits, these were people who were conscripted who were there. So it's really, really important to recognise that COVID clearly has a physical impact, but to also recognise the impact it has psychologically on people. So this may be sort of issues that we've seen. Yesterday was very interesting, where a number of people who were very, very keen to talk about their experiences where they'd had some very minor impacts, sometimes a couple of days, and they thought that was okay. And then months later, many 5-6 months later, they were still struggling with the psychological and the physical impact. And we've heard from their speakers before talking about the impact this has on people's lives. But COVID has a psychological impact. People will not be able to work, people on 0-hour contract, people who have limited savings. I was really struck by statistics I heard earlier this year that says that the average person has less than £100 in savings, disposable income. And when we hear about how many people we are working with in our communities, within the minority communities, black minority ethnic communities, we will see that more and more people are disproportionately impacted by COVID. We're also recognising how with a high number of nursing staff from minority backgrounds, they will be seeing the impacts of COVID. They will be worried about the impacts of taking the virus back home. Many of us from our communities live in multi-generational communities. So young people, young hospital staff will go from the ward. They will go from that ward. And remember, many of us from minority backgrounds work in some of the most deprived parts of the NHS. We will then go from there to multi-generational homes. So there's concerns about passing the virus on to parents and grandparents, and all of that causes huge amounts of stress. And let's not forget the huge sacrifices people from our communities have made in keeping care homes where there's been a huge impact of COVID. And so people would often live within the grounds of the hospital, or they would not see their loved ones for fear of passing on the virus to their loved one. So what are the symptoms of post-traumatic stress disorder? The re-experiencing the trauma. A person may have nightmares or experiences or flashbacks. So these may be sort of mini flashbacks. They may be more substantial. They could be, certainly at night times, there could be multiple trauma experiences. And their loved ones, near ones, will hear people sort of crying out. They may be living them. They may not be able to go back to sleep. So exhaustion from having lived those experiences. So the re-experiencing the traumas are very common, unfortunately. People will want to avoid certain situations, and there may be no logic into why people want to do that, but that's part of the symptoms of PTSD. So it may well be that people who have been involved in a particular situation involving a vehicle may want to avoid going into a car, and that there may be no logic for some people in that happening, but if you have that PTSD, then you will be. It will not be unusual to be wanting to avoid those kind of situations. Experiencing negative changes in emotions and beliefs. A person may experience changes in the way they think about themselves and others around them, often their loved ones. They may also forget about parts of the event that are unable to experience loving feelings towards others. And I think this is really, really important. So those around them who are their loved ones, who are providing them with support and help and assistance, they often bear the brunt of the the negative impacts of the PTSD. And hyperarousal, these may experience difficulty sleeping and concentrating, and they may become easily startled. So, you know, people who are generally very, very confident and suddenly become a shadow of themselves. So I think we just need to really understand, and if you know loved ones who are going through this, and certainly lots of hospital staff now having that additional support, and we really need to make sure that we don't have the shame, and there is more shame in certain communities around mental health and mental well-being. We need to make sure that people understand that this is happening to lots of people, and what can we do to try and avoid people being ashamed and too embarrassed to speak. So what are the techniques to address post-traumatic stress disorder? So talking to friends and families and others on a regular basis. So we're fortunate to have the internet. There is still some communities that will struggle to get the Wi-Fi, and the costs can be sometimes prohibitive. But I think being able to talk is really, really important. And often people will want to talk about the same kind of issues over and over again. And we need to understand why people are doing that and give people the time and the space to be able to do that. So whether that's through texting, people set up WhatsApp groups, people join Facebook groups, or having the space and time to talk to other colleagues. And often it will be people who've had that experience will perhaps understand more than others. So try to stay calm. So look at doing some other. We've seen a very, very great exercise from Boxercise class there, but there may be other things you might want to do. So practicing yoga, relaxing, things that aren't as strenuous, looking to eat well, and eat regularly, and eat healthily. That's much more easily said than done, but try and avoid the fast foods, the processed food, and try and eat and make time to cook healthy food that will help you. And for some, it may involve taking medication. So don't be discuss that with your GP. And if there may be a time where you need to take medication, be it for a small time or for a longer period, then that's perfectly normal. And I think be guided by what your doctor says and what your GP says, and avoid stressful things. Those people working in the NHS, they cannot avoid seeing news stories about COVID all the time, all around them. It is often it is the first item on the news. So people might need to avoid reading newspapers, watching the news, going to the BBC News website. Just give yourself a break from these kind of factors that may cause you additional trauma. It's about focusing on a sense of control and try and improve your control. Be prepared to accept that you may find it more challenging to deal with some stressful situations, and actually acknowledge that. So you may have been very, very robust if you're working in a ward where people have got behaviour and stepping in and dealing with that. But there may be times where you want to avoid that and want an opportunity to do some less stressful work. And it's important to raise those issues with your manager and see how you can be given a break from the really, really stressful situation. And I think finally, just to remain hopeful. I remember as a police officer having to deal with some incredibly stressful situations. As a young 20-year-old, seeing dead bodies on a regular basis, seeing people in horrific accidents, seeing terrible situations. But you learn to develop those techniques. There will be an opportunity to come out of this, and most of us will. For some, it will take time. For some people, it will be short time. For some people, it will be long time. Remaining hopeful is really, really important. What do you do if you're a friend or a relative of somebody who's going through this? Well, it's important to learn about post-traumatic stress disorder, and there's lots of literature on the NHS websites that talks about this. So having that understanding and understanding why somebody may want to keep on talking about these issues, understanding why people may feel anxious, why they don't want to go to certain places. So just understanding it, and it's perfectly normal to have post-traumatic stress disorder. It's not something that only a few people get. Most of us will have it in some mild form if we're continually put before crisis and trauma. Help manage their medication. So, I think sometimes, certainly I know police officers that have been very reluctant, and nurses very, very reluctant to seek help. But when they've had help, sometimes it means taking medication. Sometimes they may need that support in being able to take their medication or to stay on that medication while the medical the advice is there. Be prepared to listen, and sometimes it will mean you won't have the kind of conversations you've had in the past, but being able to listen to the same issues, talking about the same scenario, and allow them to do that, and encourage them to have contact with other people who have that support network. So talk about WhatsApp groups, Facebook groups, and try and make sure that they have that opportunity, or to physically, where it's safe to meet with other people in a socially distant way. And I think this is really important. If you know someone who is suffering from the stress and maybe doing self-harm, considering suicide or hurting another person, you have to ask yourself, what can you do to help them? And don't be frightened of calling 999 to get help and support, the ambulance or the police service, just to help. I mean, that is at the extreme end, but always remember that that's something for you to consider. Sort of tips for caring. Looking after somebody with PTSD can be stressful, so it's also important to look after yourself. So, what can you do? Because if you fall over, if you then suffer a breakdown yourself, then the person you're helping to support will not have the support that they need. So if you're looking after someone, you should make time for yourself. Not feel guilty. It's normal to feel helpless, because if you're living with somebody 24/7 and having to deal with the challenges that they have, and it may well be that some people sometimes take sick leave, so they may be with you longer than they ordinarily would. And I think we've all seen the challenge of being in sort of lockdown situation. Take care of your own mental health. So make sure you understand what helps you and what you need to do. Do you need to go for a walk? Do you need to have time out? Do you need to watch a movie? Do you need to de-stress? Do you need to go and spend time with somebody else? Think about all of those things, because your well-being is absolutely crucial when you're looking after somebody. Your physical health is really important. I think the danger is that we avoid that basic physical exercise, and I think particularly with lockdown, and we may well be heading into another version of lockdown very shortly. Sometimes the simple things of sort of going to work, traveling to work, all of that is little bits of exercise. We don't do that in a lockdown situation. And again, just re-emphasizing sort of eating a healthy diet and making sure that you're doing that on a regular basis, and take time to cook. I've certainly found during lockdown, the things that I've done in the past, and probably little time, but I've actually had time much more for cooking. And I think just to end with, COVID looks like it's been here for a long time. We've had the lockdown situation since March in this country. There's suggestions that it's going to be with us for maybe a year, maybe longer. Lots of talk about a vaccine. There is no vaccine at the moment, and even if they get a vaccine, it takes time to give that to everybody. BAME staff are considerably more at risk of contracting the disease than other health staff. 11 of the first people who died within the NHS were from BAME background. And there's a whole, if you look at the statistics, over 60% of the staff that died in the NHS were from minority backgrounds. So we need to look at the data and look at the facts. So as we head into a second wave, we need to understand what the challenges are, and we need to ensure that we learn from what happened in the first wave. It would be a tragic mistake if we had that high proportion of BAME staff dying in any second wave. We need to understand what the challenges are, and BAME staff need to, if they want protection, personal protective equipment, they need to ask for it. And I would encourage people to ask for that. And if you're unhappy about being in a situation, articulate that with your line managers, because we've seen very, very clearly that BAME staff have been disproportionately impacted in terms of their well-being and the number of people who have subsequently died. So in some ways, it's as we head into towards another COVID. Those of you watching the news today will see that Scotland is talking about a full lockdown for 2 weeks during its school holidays. There are suggestions that we might have something more substantial in England as well. So in some ways, it's a difficult message as we head forward. But I think I would just like to leave people with the view that if you are in any way concerned about your physical health or your mental health, it's important to talk, raise those issues with your loved ones, and raise them with your line managers at work. So we are not in a situation where we end up with the same high level of BAME people losing their lives in the health service as we did in the first one. Thank you very much.
Right. Thank you so much, Mr. Babu, for that very informative. Right. I don't know why you're still pinned, but thank you very much. We really appreciate that. Our next speaker, admin, can you help me? I don't know what's happened. He's still pinned.
That's okay. He's not pinned.
He's gone.
Yeah.
Oh, okay. Okay, fantastic.
Let's take some questions for Mr. Babu. While we wait for either Joel or Stefan to come back to us. I'm just cutting through to see if people have asked questions, but I'm going to throw one to him and maybe kickstart. Mr. Babu, thank you very much for your presentation. And considering you're also the chair of SICO group, that is you will explain to us what it means.
Yes.
And I understand is non-executive directors, NHS non-executive directors, BME group that came together. We've been hearing about the impact on the BAME NHS staff. However, I haven't seen through my local team, that's NHS team or community or the council, any support that has been made available for this community that it has been impacted on. I work with a number of women across UK and Europe. A majority of them are in the healthcare system. And we know that even the agency staff comes mostly from BME group. So we talk about the impact it's having on their life, but there is no support system for them and their families. Can you tell us what is your view on that, please?
Okay, well, first of all, thank you very much for all the kind comments, and I'm looking forward to seeing presentations, and I think you have a copy of my presentation, so that would be really, really helpful. It's been very, very enlightening. So the CPOL group is a new group of Black and Asian minority ethnic and board members. So each hospital or each mental health trust or clinical commissioning group has a board, and that board is made up of people from who've got experience in a whole range of different areas. So what's very, very troubling is at the moment only 7% of the boards are at the most senior level are from minority backgrounds, from Black, Asian minority backgrounds. And if you look at the high proportion of nurses, particularly doctors from minority backgrounds, it's a very low figure, incredibly low figure. So we've set this group up to try and ensure that we have a voice, and we have over 80 members, which is the vast majority of the non-executive directors from minority backgrounds across England. So we have members up and down the country. And what we're doing is to try and share information and provide support for each other. And also, it can be a very, very lonely place when you're the only person of colour on a board, and you are raising the same issues that this conference is talked about. And we have to be brave. We have to ask the question, if you look at the disproportionate impact of BAME staff, of Black and Asian minority ethnic staff within the NHS in terms of COVID, the first 11 people who died were people of colour. So we have to look at the facts. We have to challenge the NHS. And I have had to challenge in the police. In the police, I could count on one hand when I joined Tottenham the number of people that did not use the N-word or the P-word. It was a horrifically racist organisation in the 1980s. And we've made a lot of progress. But it's interesting, when I was having this discussion with a doctor, he became a doctor in the early 80s. He says, you know what? The N-word was very common in the NHS in the early 80s. So I think we just need to acknowledge the level of discrimination that we face. And actually, we're in a moment now where we can work together and we can challenge. And so challenge is really, really important. And I always say to people around challenge is, stick to the metrics, stick to the facts. Stick to the facts about where we are in terms of how many senior people are there of colour in your organisation, how many people are being disciplined, what are the resources that are being given to people of colour at this time. Stick to the facts. And I think the CECO group, we have a website, so if anybody wants to see what we're doing, and we've got people's journeys of their leadership journeys from a whole range of different backgrounds to see. Many of us came from very, very modest backgrounds. I myself, I was one of 10 children. My parents came here. We were suffered quite a lot of racism, poverty, and it was through sheer determination that I am where I am. So we are encouraging people to look at our website and look at the journeys that people have made, often from very, very modest backgrounds. So you mentioned Sharon. Sharon is the deputy chair of the CECO group. Again, very modest background. So we are people who really understand the challenges and really want to use our experience to impact on the NHS.
Thank you very much for your answer.
So our next speaker is the Reverend Stefan Dawkins. He's going to be speaking on understanding the role of faith communities in rebuilding the mental well-being, family values, and relationships. He is the current parish priest at St. Paul's Church in Tottenham. He arrived Tottenham September 2018 and soon discovered the challenges caused by poverty and faced by many in the inner city, not least the mental health, drug and alcohol addiction challenges faced by many in the Tottenham and Edmonton area. Prior to Reverend Stefan's ordination as priest, he worked for many years in mental health advocacy as a professional community and hospital mental health and mental capacity advocate. He represented some of the most vulnerable of all ages and at different stages of their mental breakdown. So I'm just going to welcome Reverend Stefan to take the stage.
Thank you for the introduction, Reverend Stefan Dawkins, St. Paul's Church, Church of England Church in Tottenham, North Tottenham. We're in one of the poorest areas of England, and even with its challenges, it still remains a joy from my perspective, to work alongside many services and of course the people of Tottenham bring about change for so many, and through our collective worship, collective efforts. Oh, you have it, fantastic, okay. Collective efforts. I have been asked to speak on this topic, understanding the role of faith communities in rebuilding the mental well-being, family values and relationships. Is quite a lot, but it's possible. And when I say a lot, I don't mean in terms of the topic, but I mean in terms of work. It will take work and commitment. But before I delve a little deeper into what I want to say, first, I want to say prior to my ordination, like you've said, I worked in some of the most vulnerable people in society at a time when statutory advocacy, I don't know if many of you know about statutory advocacy, you may do, was introduced by the UK government to ensure those with the mental health challenges have the support and the representation they needed to help them live close to normal lives. Before I move on, I want you to have a look at this slide here. Oil on Canvas by Vincent van Gogh, the Pieta, painted in 1889. A lot of people tend to think that people who like different from us, obviously, don't understand that mental illness doesn't have a specific person or race or creed. It affects everyone, even the greatest that we would consider among us. One of the most celebrated, influential artists, Vincent van Gogh, created over 2,100 artworks, over 2,100, suffered psychotic episode and delusions, even though he was one of the greatest and created some of the greatest paintings that we've seen. He's an impressionist, as you can see from the painting here, a painter, and he painted this piece here, this particular piece that you're looking at the end of his life. Now it depicts the Virgin Mary, his mother, mourning the death of her son, Jesus Christ. And he identified this image with himself, suffering, misunderstood, ridiculed by people, many of whom were from his own community. Perhaps we can find some parallels between these two stories, Van Gogh, Jesus, and the stories of many of us today, many people today. What we must first recognize is that mental health is a real challenge for many. And I remember watching an interview just last week, or might have been this week, early this week, where one celebrity who is part of an ITV Let's Keep Talking Mental Health initiative said it's not just, I know some of my colleagues here have said 1 in 4. He said it's not just 1 in 4 that are experiencing mental health difficulties. Guess what he said? It's 4 in 4. 4 in 4. Chew on that for a little bit. It made me sit up and think, because all those years, please do not skip the slides forward. It made me sit up and think, because all those years of representing others, I have never put myself in that category. But he said, actually, if we all think about it long and hard, we might find that at some point in our life, we have experienced challenges, whether it be through formal diagnosis, mild depression or anxiety, it all counts. But one of the interesting things I've noticed in my experience in visiting mental health hospital wards or units was how important people's faith meant to them in the midst of their crisis, their faith. I just want to say, and speaking more directly to the topic, I've been asked to speak on how important it is to recognize that many people dealing with mental health challenges have lived full creative lives. Many have families. Many have had fulfilling relationships, all of which were affected by either a slow or sudden breakdown. As a member of the faith community myself, and as a person of faith, obvious reasons, I believe faith communities have a vital role to play in rebuilding what many people have lost through mental unwellness. But we recognize this is a challenge for more than one reasons. One of the main reasons is that, and this is what was established during my time of training, when I was training for ministry, and it is this: many church or faith communities, many faith communities do not understand how to deal with what is going on with their loved ones or experiencing a mental health challenge. Even if they have a desire to help, they do not know what to do or where to start. This is the reality of the faith community. And I believe this is partly because there is a disconnect between faith communities and external agencies. And perhaps this is partly to do with the idea that some members of faith communities or faith groups mainly see mental illness as a spiritual problem. That person then needs to be more than just spiritual input. And faith communities are not equipped otherwise. But all hope is not lost, because in fact there are faith groups or faith movements that recognize that they have a role to play and have taken steps towards addressing some of the challenges resulting from mental unwellness. So, if you have a look at this slide, I don't know how many of you have heard about this organization or this movement, the Lucerne movement, launched by Billy Graham in 1974. At the launch in Lucerne in Switzerland, Christian leaders came together to start what became one of the largest conventions of its kind, where 2,700 Christian leaders coming together in one place. It is said that the outcome of the historic gathering profoundly influenced mission efforts on every continent with a new spirit of servant leadership. I want to emphasize that phrase, servant leadership. And Jesus said he came not to be served, but as one who serves. And so many years later, they have expanded their mission efforts and have now taken on the challenge and indeed a new initiative of turning the church's attention to mental health with a theme, binding up the brokenhearted. And we know that Jesus said he came to bind up the brokenhearted. In other faiths may recognize this saying as well. So in their manifesto, they say this: mental health problems are usually the result of a combination of many factors, including family environment, biology, personality, spirituality, and challenging community context, including poverty and violence. Increasingly, the impact of traumatic events such as childhood abuse, interpersonal violence, or natural disasters are being recognized as major causes of mental health problems. And some of my colleagues have already mentioned some of these, some of the previous presenters. And so with this in mind, the Lausanne movement calls all churches and faith groups to focus their collective attention on helping to tackle some of these issues. Now, it is important to point out that the responsibility of tackling mental health problems or issues that plague our society does not just lie at the feet of the Christian church, but it is a responsibility of all faith groups, because people of all faiths, communities, culture are affected in one way or another. But speaking as a Christian and as a priest, I want to concur with the Lausanne organization's view that mental health care is scriptural or biblical, which makes the role of faith communities that much more important. For example, look at this image that I have up here, depicting the Good Shepherd. We know that Christ is the Good Shepherd, but this is an older African gentleman, this image by John H. Boer, coming as Christ the Good Shepherd, as the Good Shepherd, not Christ, but the Good Shepherd. He seems to be comforting someone who is in distress in a bad way. And there are others around. Others seem to be rejoicing that he has come, maybe to liberate them from something. We don't know. But if we look at scripture, the prophet Isaiah, for example, says, or describe part of the mission of the Messiah, the coming Messiah, is to bind up the brokenhearted. Do we see that in this image here? Jeremiah wrote of the Messiah, I will turn their mourning into gladness. I will give them comfort and joy instead of sorrow. Can we see that in this image here? In the New Testament, we see that Jesus went through all the towns and villages, teaching in their synagogues, proclaiming the good news of the kingdom, and healing every disease and sickness. Can we see that in this image here? Jesus did not just proclaim the good news for everyone, but he also demonstrated the good news in the way he treated those living on the margins. And it is this that we are called to emulate. Now, I think that other faiths can relate to this. Now, many of us will remember that experience between Jesus and the demoniac. Now we're coming on to some meatier matter. Jesus and the man who was possessed by a demon. In other words, one who was said to have demon and was tied up in chains. Do you remember that story? Ostracized by his society, separated from family and community. But we know from thorough study of the scripture that demon possession was the term they used to describe someone with a mental illness. And now here we are in the 21st century, 2,000 years later, and in some cultures and communities, still individuals refer to someone with a mental health challenge as having a demon. This is a reality we must accept and admit. And if we are to be honest and frank, we do have in the BAME community this thinking that everything is linked to some sort of spiritual problem or demonic possession. Many are demonized. Many with mental health challenges are demonized and isolated within their own communities. And sadly, those most affected are those from the minority ethnic groups because of the stigma around mental health. I believe it is now time for those within various faith communities and indeed faith leaders to work towards helping to eradicate the stigma, changing the way we're thought of, particularly as Black and or people from the BAME community, the prejudice faced by their own people, our own people. And we need to work in a more collaborative way with other services to rebuild what has been lost by those living with mental unwellness. For those who preach about God of love, whether it's in Muslim, you're a Muslim or Christian or you know, a Buddhist or whatever religion you are, the love of Jesus, and even faith communities who do not refer to God, but refer to a higher being whom they worship or we worship, must now come to recognize that all religions or faith have responsibility for asserting a message of peace, love, compassion, community, and wellness for everyone. Now, we cannot afford to continue failing our communities by remaining quiet and leaving it to non-religious communities to promote well-being. The mental well-being of everyone should be everyone's responsibility, including all faith communities. In 2009, Redbridge Council commissioned a research into the role of faith in mental health with the help of Redbridge Faith Forum and Redbridge Concern. They spoke to 6 different faith groups from the Redbridge community, one of the most ethnically diverse boroughs. I have worked there for many years, so I know this. And so they spoke to people from Buddhist and Zoroastrian, Christian, Hindu, Jewish, Muslim, and Sikh faiths in different locations in Redbridge. Now, out of that focus group study came 11 conclusions, but I could not help but notice these 4 important conclusions. 1, there were alternative beliefs about the cause of mental health problems, including possession, more prevalent within ethnic minority faith communities, and in some cases prevent people from seeking help from statutory services. So services may be available, but they do not seek help or refer themselves. For this reason, many of these people feel that only a member of their own faith or ethnic group will understand their needs. For this reason, faith workers can play a pivotal role in supporting and encouraging people dealing with mental health problems to make the transition to using statutory services. So I know we talk about not enough services being available, but what I found is that one of the reasons, or one of the problem was during my time, was that majority of the times, the referrals that we got were from people of who were white. The second conclusion that that got my attention was different faith workers also identified a range of challenges facing themselves and their congregants, their congregation. These included the pressures of modern life, both for the working generation and the elderly, family problems, forced marriages, comparisons with others, loneliness, and isolation, language difficulties, and worry about children's safety and substance misuse. For faith workers, there is also the challenge of serving a very large population and having limited resources with which to support them. So this is an issue that some of our previous speakers have mentioned. This is a reality which continues to plague the BAME community. The lack of sufficient funding to realistically manage the wide-ranging issues of mental unwellness. The third conclusion, some participants felt that only mental health professionals from their own culture or spiritual background can understand their needs. So again, the role of faith workers in caring or supporting those suffering with a mental health challenge. The problem is, church or those in faith groups do not fully understand how to deal with mental health challenges faced by their community. The fourth conclusion, faith communities provide significant social support to people suffering from mental health problems. Spirituality plays a crucial role for many people experiencing distress in their lives. And furthermore, spiritual practices from prayer to yoga, someone mentioned this earlier, meditation, provide comfort and a focus for recovery. Religion provides a sense of belonging, hope, a sense of control and coping mechanisms, all of which are fundamental to good health, good mental health. And faith workers are at times put in a position in which they must play a role in emergency care of a person in crisis. They are not equipped, they're not trained. And they often take on these informal roles as counselors. Again, they're not equipped, they're not trained. The last slide. Yeah. Now, I want to conclude by saying, adding some thoughts from a book I read on spirituality and mental health. The book was written by Tasia Scrutton, who suggests that if we see God as not suffering, we will hide away from dealing with our illness. And we remain in our illness because we think it is something we have done wrong or have caused on ourselves. If we separate our suffering or the suffering of others from God, we are in trouble. Because we are then saying that God does not understand our suffering, or perhaps we're being punished by God. But actually, this thinking is far from the truth. Scrutton said that the God of Jesus, the God of all of us, whatever your religious persuasion, suffered through Jesus Christ. He is the God of those who suffer abandonment and exclusion. God is on the side of those who suffer. The problem is, if faith communities continue to be silent and continue to demonize those with mental health challenges, we are far from rebuilding, and indeed we will do nothing towards rebuilding families or relationship and or communities. But what we need going forward, I think, if faith communities were to understand their own role, is to have a more multidisciplinary approach, not just the statutory services over there working over there, voluntary services over there working over there, and then the church and other faith communities do the little bit that they can over here. We need a more multidisciplinary approach. We need to have a system in place where all of us can come together as communities to work together for resolving some of the issues faced by our own community. Thank you very much.